sadly, we had 2 Albany County residents pass away. 2 women died from the virus. They were both in their 70s with underlying health conditions. My condolences and prayers go to the families and to the other 113 families that have gone through this. I know we're in phase 2. I know things are opening up. You drive around, you don't realize things have changed to some degree. But these families still fall under the guidelines of how to have funeral services. So people can't go to say goodbye the way we used to. The families couldn't say goodbye in certain cases because if they're in a hospital or someplace, they couldn't get to them, or a nursing home. So it's difficult. And it's still difficult times out there. So I just want to remind everyone out there, the virus is still there. I know a lot of ways we feel like it's not, but it is. And to the 2 families that lost loved ones, again, my heart and my prayers and thoughts go out to you and your family, to all 115 families. To the essential workers now and the non-essential workers back and seeing the new world, I know things change, and I know we are in a different direction. So please be part of the solution, not part of the problem. So as of today, we have 1,792 positive cases, up 14 since Friday. We have 606 people under mandatory quarantine, that's down, and we have 6 people under precautionary quarantine, and that's up by 3. There are now 12 people hospitalized with a hospitalization rate of 0.666. Of those who have tested positive, Friday the rate was 0.84%. We're getting into some very, very low trends now. We're down 3 people from the hospital. Same with ICU. We're at 3 currently, and we had 3 as of Saturday and Sunday. So over the last 5 days, our averages of new cases have been 9 new positive cases each day, which is also good news, especially with all the protesting going on and more people being out in the workforce. But I do urge people to get tested, not only if you have a symptom, but if you're heading back to work during this new phase, and if you have been involved in any of the rallies or protests, like the ones going on today in Troy. We set it up on Warren Street. We had 78 people show up, which was great. We're doing it again. We're going to be setting it up June 10th from this Wednesday on Warren Street again from 9 a.m. to 11. But to any of our mobile testing sites, please just show up. If you've been out rallying, you're a first responder, just all you need is your ID card. You don't have to fill out paperwork. And if you have insurance, great. If not, we're going to pay for it. So we want to continue to get you tested. So one of the things I'll get into tomorrow or Tuesday, our COVID dashboard that we put up. And one of the things I kept talking about that I was tracking was the 20 to 29-year-olds, right? And I said they were neck and neck with the 50 to 59-year-olds, and that was our second highest positive cases, and then the other ones broke down. So for the first time, our 20 to 29-year-olds are the highest rated positive cases. And I'll get into that with Liza Whalen this week a little bit, but that's the one that I've always go to. That's the one that I'm always following. And again, you don't have signs or symptoms. I get it. And to the families that say I'm trying to scare your kids, well, no, what I'm trying to say is they get it. They have no underlying issues. They have no signs or symptoms, and they continue to spread it, or they give it to somebody that has underlying health issues, or someone's in that category where they have to be careful. And that's the one thing I continue to point out, that we're seeing, as you see that number grow, because now we're getting into phase 2. Things can speed up because the numbers are all looking good. Other cases, it's still there. People are still getting it. So please, just by all means, be careful. As always, our mobile testing site numbers, area code 518-465-4771, 465-4771, area code 518. And for essential workers and people going through the Albany site, as always, the number is 1-888-364-3065, or you can go online and Again, you have the Seth Q Arena, and you have the drive-through, and we have the Priority One in Gilliland, and the Rite Aid test site. So please, all available to you, and I'm encouraging you. I can't control the ones at Albany or the one at Rite Aid and Central Avenue, but our mobile testing sites. If you feel you've been out, you've been exposed, please come get tested. And we'll know from that group from Thursday, the 78 that we tested. Hopefully we'll know by Tuesday the latest of where them numbers stand to see if that is affecting us going forward. I know all these rallies are out. So again, we just want you to do it peacefully, and we want you to do it by wearing masks, social distancing, coughing into your arms, and continue to clean your hands. So please keep that in mind. It's challenging right now with everything going on. A lot of the questions that we've been receiving, and when I walked around my old neighborhood in the South End yesterday, is the numbers, right? They look good. Everything looks in the right direction, and they're saying, well, why did we shut down for 13 weeks? Why did we, why weren't we couldn't go out, we couldn't go to work? And look at the cases. Look, and I've said to people, I look them right in their eyes. I'm not a scientist, and I saw the way this affects other places in the world and other states. It's there, it's real. The governor's trying to do the best that he can to go in the right direction, and so are we here to protect the people, because the safety and health of the residents are first and foremost our responsibility. So we want to make sure that we did everything correctly. It is hard when you say to people, you can't have graduations, you can't do this, and you see people protesting now. It's tough. I can't answer that. I have to take guidance from the governor, the control room. These are legit concerns that people are bringing up. Why can I go and protest with thousands of people, but yet my kid can't walk across the stage in a proper way? Can't answer you. I'm going to be honest and look you right. Well, I'm going to look into the cameras and tell you that I can't give you an honest answer. We send it up to the guidelines through the control room. I know people are anxious to get back to the norm. It's never going to be the new norm for a while. Things are going to change around us, and we have to do this together in a partnership. We have to do this together collectively to get through this. And I need everyone out there to continue to do the right thing. And maybe that's one of the reasons why I think our numbers were, so low compared to other places, because we did do the right stuff here in Albany County. We continue to do the right stuff. So I ask, when you're out, or you're at Thatcher Park, or you're out in Gilliland going to your restaurant, it doesn't mean it's a free-for-all. It doesn't mean you can set tents up and play Bag-O and everything else. It's still real, people. The virus is still real. And hopefully seeing these next couple of days of where it's at with everyone out, enjoying the fresh air and everything else going on. And we'll see where the number's at, and we'll go from there. Another couple questions I got was basically the briefings. What happened to you yesterday? I go, it's been 13 weeks. My staff hasn't had a day off. You can see fatigue. We're getting fatigued. And I thought no better time when the numbers were looking a little bit less to say to everyone, you know what, we need to take a step back and take a deep breath, because it's, again, I keep saying this, it's a marathon, it's not a sprint. People are getting burnt out around me. And it's tough. And then you get you do get some of the heartache. People are like, well, why do I have to come to work for 13 weeks and everyone else sat home doing nothing? And I go, well, A, thank God you have a job, and B, just be glad that you're healthy, and move forward. So I made a conscious decision. And as I will from now on going forward, we'll let you know in the morning whether or not, I'm not going to call everyone down here to do a briefing if our numbers are only going up, 6, 7, or 8. I want to bring people here to give out good guidance that we get. So if the governor changes something, or the control room gives us information, and unfortunately, if someone passes away, we'll have a press conference. We're going to kind of change things up as we go forward, just because we're all adjusting. And I'm hoping, if this is the new trend of the numbers going forward, that we will hit phase 3 before the date. and we'll hit phase 4 before that, and things will change. I think the numbers are good, and if it continues this way with all the protesting going on, there'll be no reason to wait till July 1st to get into phase 4. When it comes to sports and playing, I know that's been a major question that I'm getting from a lot of people. Look, it's still not saying we can do it. I don't, going forward, playing different sports, be it baseball. I know the coaches want to get out there for the summer. My daughter lost her lacrosse season this year. I feel bad for the seniors and the ones that this was their last year playing lacrosse, or the ones that graduated from college. I can't say this anymore. I wish I could give you guidance. I wish I could tell you that you can have a season. I don't know. And I can't see kids running around playing sports with masks on, especially kids that have breathing problems or asthma or other issues. Last thing you want a kid running around with a mask on and passing out because they can't breathe because of the running. Because it's getting hot out, and everyone knows wearing that mask, you pull them off, you're sweating. So these are things that we have to consider going forward. A lot of coaches came to me with a lot of great ideas of how they could do it. I don't have the authority to sign off on that. We push it up to the governor's office. Same thing with summer school. If we're going to have camps, why can't we have summer school? I was glad to get speech and OT moved into phase 2 so we can get these kids back. And no, to all the women out there and men that keep asking about getting their nails done, it's phase 3. I can't explain it. I know, but it's phase 3. But things change. And I think as the numbers, if they stay this way, they'll change, they'll come back, and you'll see things open up quicker. But we will be adjusting here, and how we're going to move forward, because government has to continue to operate. We have to continue to move in the right direction, and as things open up, more services are going to be needed from the county. And I got a budget now I got to deal with because of the fallout from the economics, and the fallout we're going to get from the Senate and Assembly on how much money, if they don't get bailed out on the federal government, how much money they're going to push down the counties. Because it seems like we're always the one paying their bills when they can't pay theirs. So these are things I have to address and think about going forward, and what we're going to look like in the workforce going forward. So there's always different decisions and problems going on. But I do want to remind people, if you're having mental health issues, please, the support number's there for you 7 days a week from 8 a.m. to 8 p.m. and the number's 518-269-6634, 518-269-6634. Our 24-hour sexual assault hotline number is always 518-447-7716, and the 211 number, and as always, the New York State hotline number. And yes, we did get questions. We tell you how many people use our mental health. I'm not going to let you know who they are. We offered it to, first responders, to police, firefighters, EMS, to anyone that was a first responder out down there, to any of the business owners that went through tough times with all this going on. It's there for you. It's in confidence. We're not going to share that number, but I remind everyone needs to take a step back every now and then and just take a deep breath and remember, we're going to get through this, and we're going to get through this together by leaning on each other in a partnership way of coming out of this as a community, being stronger for each other, understanding each other a little bit better. One of the things I heard when I was out and about yesterday, and it's some of the stuff we got on our Facebook and emails, was that the shops that are boarded up in Gilliland, in Colony. Now, I got to tell you, being a kid from the south end of Albany, it was the norm. I didn't think anything different until I moved out of the south end. People in these communities are used to seeing that, growing up with that. It's a little shocking that people outside these certain areas of the city that now are for the first time driving around saying, hey, why are these buildings boarding up? It's kind of an eerie feeling. Now, imagine being a kid growing up like that every day of your life, 7 days a week. That's all you see in your neighborhood. This is this is the norm to certain people in certain communities where I grew up. So I didn't think anything about it until I moved out of my neighborhood when I was a kid and got married and moved out, saying, wow, where's all the boarded up buildings? Kind of forgot about it, but then as driving around again with all this going on, reminded me of my youth. But most importantly, when I'm talking to other people outside of them areas that have never seen this, kind of sets that surreal feeling in saying, wow, there's a change in this world, and there's something more going on than we predicted. Or you've been home for 13 weeks and you come out and you see that. It's a different, interesting view when you talk to someone that's never had to see that or dealt with it. And I'll be quite honest with you, it didn't affect me because I was used to it. I just didn't think anything of it till people started saying something to me, and I'm like, you know what? You're right. You're right. But again, be safe out there, be healthy, continue to do the right stuff as we move forward, and we'll get through this together.